Reassess the pain complaint or movement dysfunction. Wrist pain, radial carpal glide. Medial hamstring strain, lateral muscle glide. Indication for this technique is pain in the medial hamstring muscle with knee flexion. Locate the painful site in the medial hamstring. Using your thumbs, glide the hamstring muscle laterally. If positioning of the hamstring with a lateral glide allows pain-free knee flexion, then apply 5 cm wide strips of tape over the painful site on the hamstring muscle. Relocate your thumbs on the hamstring muscle. Repeat the lateral glide force previously described. Pull tape in a lateral direction and anchor to the lateral aspect of the thigh. Reinforce with 1 or 2 additional strips. Repeat the same glide and force, pulling more firmly. Reassess the pain complaint or movement dysfunction. Medial hamstring strain, lateral muscle glide. Trochanteric bursitis, TFL muscle glide. Indication for this technique is lateral thigh pain secondary to trochanteric bursitis. Locate the greater trochanter. If positioning of the lateral soft tissue with an anterior-superior glide is pain-free, then apply a 5 cm wide strip of tape posterior and superior to the greater trochanter. Using the palmar aspect of your hand, superior to the greater trochanter, glide the soft tissue and TFL in an anterior direction. Pull tape in an anterior and slightly superior direction and anchor to the abdomen. Ensure tape will cross the lower abdomen just beyond the midline in a slightly superior direction. Reinforce with a second strip, repeating the same glide and force while pulling more firmly. Reassess the pain complaint or movement dysfunction. Trochanteric bursitis, TFL muscle glide. Knee pain, internal tibia rotation. Indications for this technique include anterior patellofemoral pain and medial or lateral compartment pain. Place the knee in slight flexion and internal tibia rotation by slightly pronating the foot. The subject can also be encouraged to rotate the femur externally, but ensure that the big toe remains in contact with the floor. Using the heel of your hand posterior to the proximal fibula and overlapped contralateral fingertips on the tibial crest, apply an internal rotation force with both hands. If positioning of the tibia in internal rotation is pain-free, then apply a 5 cm wide strip of tape posterior to the fibula head. Ensure that tape will not cross the patella. Repeat the internal rotation force previously described. Pull tape in anterior medial direction, then superiorly in a spiraling posterior direction onto the posterior hamstring. Tape should cross the joint line medially and extend halfway up the hamstring. Reinforce with a second strip, repeating the same glide and force while pulling more firmly. Reassess the pain complaint or movement dysfunction. Knee pain, internal tibia rotation. Knee pain, proximal and distal tibia-fibula glides. Indication for this technique is when augmentation of taping to the distal fibula is needed for dorsiflexion. Note that the distal fibula has been taped as described in the technique for ankle inversion sprains, distal fibula glide. Locate the proximal fibular head. Using the heel of your hand posterior to the proximal fibula and overlapped